Your doctor just handed you a blood test report. There are over 20 different numbers on that page, and there is a very good chance your doctor explained almost none of them. So right now, you have no idea if those numbers mean you are perfectly healthy or if something serious is going on inside your body. In this video, I am going to walk you through every major blood test, what it measures, what normal looks like, and most importantly, what it means when your numbers are too high or too low. No complicated medical terms, no confusing jargon, just clear, simple science that anyone can understand. Let us get into it. The first test on almost every blood report is called the Complete Blood Count, or CBC. Think of the CBC as a census of your blood. It counts all the different types of cells swimming around in your body and tells your doctor if anything looks off. Let us break it down one by one. Red blood cells, RBC. Red blood cells have one job, and they do it non-stop, 24 hours a day. They carry oxygen from your lungs to every single cell in your body. Normal range, 4.5 to 5.5 million cells per microliter in men, 4.0 to 5.0 in women. If your RBC is low, your cells are not getting enough oxygen. You will feel tired, weak, and short of breath. This is called anemia, and it is more common than most people realize. If your RBC is high, this could mean dehydration, or in some cases, a lung or bone marrow condition.
Hemoglobin, HGB. Hemoglobin is the protein inside your red blood cells that actually grabs and carries the oxygen. Think of red blood cells as the delivery trucks, and hemoglobin is the cargo inside. Normal is 13.5 to 17.5 grams per deciliter for men, 12.0 to 15.5 for women. Low hemoglobin equals anemia, often caused by iron deficiency, blood loss, or poor nutrition. High hemoglobin equals often dehydration or adaptation to high altitude.
Hematocrit, HCT. This one is simple. Hematocrit tells you what percentage of your total blood is made up of red blood cells. Normal, 41 to 53% for men, 36 to 46% for women. If you imagine a glass of blood, hematocrit tells you how much of that glass is red cells versus liquid. Too low means thin blood. Too high means thick blood. Now here is where things get interesting. White blood cells are your immune system's soldiers. They patrol your body constantly, looking for viruses, bacteria, and anything that should not be there. Normal range from 4,500 to 11,000 cells per microliter. High white blood cells is your body is fighting something, an infection, inflammation, or in serious cases, leukemia. Low white blood cells is your immune system is weakened from a viral illness, certain medications, or bone marrow problems. This single number can tell your doctor whether you have a bacterial infection or whether your immune system needs urgent attention. Platelets. Finally, platelets. These are tiny fragments, not even full cells, that rush to any cut or injury and form a clot to stop the bleeding. Normal range, 150,000 to 400,000 per microliter. Too low, your blood cannot clot properly. Even a small cut becomes dangerous. Too high, your blood may clot when it should not, inside your blood vessels, which can cause a stroke or heart attack. Have you ever received a blood test report and felt completely confused by all the numbers? Drop a yes in the comments right now. You are definitely not alone. The next group of tests is called the Basic Metabolic Panel, and this one checks your body's internal chemistry. It tells your doctor how well your kidneys are working, whether your blood sugar is healthy, and whether your body's mineral balance is correct. Blood glucose, blood sugar. This is the big one for diabetes. Blood glucose measures how much sugar is currently circulating in your blood. Normal fasting range, 70 to 99 milligrams per deciliter. Pre-diabetes warning zone, 100 to 125 milligrams per deciliter. This is your body sending you an early signal. Diabetes, 126 milligrams per deciliter or above on 2 separate tests. High blood sugar does not just affect your energy levels. Over time, it silently damages your blood vessels, kidneys, eyes, and nerves. That is why catching it early through a blood test can literally save your life. Blood urea nitrogen, BUN. When your body breaks down protein, it produces a waste product called urea. Your kidneys filter this waste out of your blood. BUN measures how well that filtering is happening. Normal range, 7 to 20 milligrams per deciliter. High BUN means your kidneys may be struggling to filter waste properly. Can also rise with dehydration or a very high protein diet.
Creatinine is an even more reliable kidney marker than BUN. It is a waste product from normal muscle activity, and healthy kidneys filter it out efficiently. Normal is 0.7 to 1.2 milligrams per deciliter for men, 0.5 to 1.0 for women. Elevated creatinine is a serious signal that kidney function is declining. Doctors often look at BUN and creatinine together to get a complete picture of kidney health. Electrolytes: sodium, potassium, calcium. These three minerals control almost everything: nerve signals, muscle contractions, heartbeat, and fluid balance. Sodium, 136 to 145 milliequivalents per liter, controls how fluid moves in and out of your cells. Potassium, 3.5 to 5.0 milliequivalents per liter, critical for a regular heart rhythm. Too high or too low can cause dangerous arrhythmias. Calcium, 8.5 to 10.5 milligrams per deciliter, essential for bone strength, muscle function, and nerve signals. An imbalance in any of these can cause symptoms ranging from muscle cramps and confusion all the way to a life-threatening irregular heartbeat.
Here is the test that could predict whether you will have a heart attack in the next 10 years. The Lipid Panel measures the different types of fat circulating in your blood. Total cholesterol: healthy, below 200 milligrams per deciliter. Borderline high, 200 to 239 milligrams per deciliter. High risk, 240 milligrams per deciliter and above. LDL, the bad cholesterol. LDL is the dangerous one. It carries cholesterol into your arteries and deposits it on the walls, slowly building up fatty plaques that narrow your arteries over decades. Optimal, below 100 milligrams per deciliter. High risk, above 160 milligrams per deciliter. The lower your LDL, the better protected your heart is. HDL, the good cholesterol. HDL works in the opposite direction. It actually picks up cholesterol from your artery walls and carries it back to the liver for disposal. Think of HDL as your body's natural cleaning crew. Protective level, above 60 milligrams per deciliter. Low and risky, below 40 milligrams per deciliter for men, below 50 milligrams per deciliter for women. The higher your HDL, the better. Triglycerides. Triglycerides are fats stored from excess calories, especially from sugar, refined carbohydrates, and alcohol. Normal, below 150 milligrams per deciliter. High, above 200 milligrams per deciliter. High triglycerides combined with low HDL is one of the most dangerous combinations you can see on a blood test. It significantly raises your risk of heart disease and stroke.
Now, I want you to pause for a second. Think about the last time you had a blood test. Did your doctor actually explain what your cholesterol numbers meant? Or did they just say, everything looks fine, and send you home? Because understanding these numbers yourself puts the power back in your hands. Your liver performs over 500 different functions every single day. It filters toxins, produces proteins, and regulates your metabolism. The liver function tests reveal how well it is coping. ALT, alanine aminotransferase. Normal range, 7 to 56 units per liter. Elevated ALT means liver cells are being damaged, most commonly from fatty liver disease, alcohol, or hepatitis. ALT is the most specific marker for liver cell injury. AST, aspartate aminotransferase. Normal range, 10 to 40 units per liter. Also rises with liver damage, but can additionally indicate heart or muscle damage. Doctors look at the ALT to AST ratio to determine the cause. Alkaline phosphatase, ALP. Normal range, 44 to 147 units per liter. Elevated ALP suggests problems with bile ducts, liver disease, or sometimes bone disorders. Bilirubin. Bilirubin is a yellow pigment produced when your body breaks down old red blood cells. Your liver processes and removes it. Normal total bilirubin, 0.1 to 1.2 milligrams per deciliter. When bilirubin builds up, your skin and eyes turn yellow. This is called jaundice, and it is always a sign something needs medical attention. Here is a test that millions of people have never had, but probably should. Your thyroid is a small butterfly-shaped gland in your neck, and it controls your entire body's metabolic speed. TSH, thyroid stimulating hormone, tells you whether your thyroid is working too fast, too slow, or just right. Normal range, 0.4 to 4.0 milli-international units per liter. High TSH, underactive thyroid, hypothyroidism, your thyroid is not producing enough hormone. Symptoms: extreme fatigue, unexplained weight gain, feeling cold all the time, depression, brain fog. Extremely common, especially in women over 40, and very often undiagnosed. Low TSH, overactive thyroid, hyperthyroidism, your thyroid is producing too much hormone. Everything speeds up. Symptoms: unexplained weight loss, anxiety, heart palpitations, trembling hands, excessive sweating. If you have been feeling off for months and cannot explain why, ask your doctor to check your TSH. It could change everything.
This is arguably the most important test for anyone worried about diabetes, and here is why it is different from a regular blood sugar test. A regular glucose test shows your blood sugar at one single moment in time. You could fast for 12 hours before the test and get a perfectly normal result, even if your blood sugar is dangerously high the rest of the day. HbA1c cannot be fooled. It measures what percentage of your red blood cells have been coated with sugar over the past 2 to 3 months. It tells the real story, not just a snapshot. Normal, below 5.7%. Pre-diabetes, 5.7 to 6.4%, your last chance to reverse course through lifestyle changes. Diabetes, 6.5% and above. This single test can detect diabetes developing years before symptoms appear. If you have not had an HbA1c test, ask your doctor for one at your next visit.
Let us do a quick recap of everything we covered today. CBC counts your red cells, white cells, and platelets, your blood health overview. Basic Metabolic Panel checks blood sugar and kidney function, your organ health. Lipid Panel measures LDL, HDL, and triglycerides, your heart disease risk. Liver function tests, ALT, AST, ALP, bilirubin, your liver health. TSH checks your thyroid, your metabolic speed. HbA1c, your 3-month average blood sugar, your diabetes risk. Next time your doctor hands you a blood test report, you will know exactly what every number means, and that knowledge could genuinely save your life. I want to hear from you. Which of these blood tests surprised you the most? Drop it in the comments below. I read every single one. If this video helped you understand your blood test report better, please give it a like. It genuinely helps this channel reach more people who need this information. And if this video helped you understand your own body a little better, hit subscribe. Because in the next video, we are going to answer something that affects millions of people every single day, and almost nobody knows the real science behind it.